Thank you for joining us today. This is a new way of doing business for us and having these meetings. We're all learning, so if there are little glitches in this, bear with us as we sort through how this is all going to work. I appreciate the reporters who cover us, and hopefully we're trying to make sure that you get the information you need as much as we have, and can provide that to you in a timely and useful manner. If you want to get recognized to ask a question, put your request in the chat box. So basically open up the little chat box, there's a little link for you to click on that and say that you want to ask a question, and then they will recognize you and turn your audio on. So there'll only be one other person other than me and Travis, I guess, with our audios on, and then you'll ask your questions. And of course, this is a conference for the media. You guys play an important role in getting information out to the public, so it's important that the information be accurate and that we're clear. So if you have questions and need clarifications, let us know if you need that. I want to share a couple of big ticket items with you before I recognize Travis Gales. First of all, we have 1,088 positive COVID cases in Montgomery County, and that's an increase of more than 200 in a day. So we're continuing to see an increase in cases. The number of people who have died in Montgomery County is now up to 26, and that number will certainly continue to rise. We're nowhere near through with this virus, and it's going to continue to take a toll in the county. We cannot be numb to the number of people that have lost their lives. This is, a loss to them and their families. And we have to do everything we can to prevent more loss of life. And so I want to, talk a little bit about what we think are the primary protective measures we've been asking people to make. The first thing is social distancing is actually absolutely critical. It does not matter where you are, whether you're on a trail or whether you're in a grocery store or you're in the CVS, wherever you are, you need to maintain at least a 6-foot physical separation between yourself and anybody else. That is the minimum that you need to maintain. This is all about stopping the spread of the virus. We don't know who actually has the virus and who is spreading it. We have no way of knowing that. If we knew that, all the people with infections are being quarantined, we wouldn't worry about who's out in public. But because we don't know who actually has the virus, we have to act as if and behave in a way that assumes that anybody could have the virus. And anybody who could have the virus is at risk of spreading the virus. So we're asking people to maintain that 6-foot physical difference at a minimum. The second thing is we're asking people to wear masks. I think personally that this is critically important, and I think it sums it up pretty well. If I wear a mask, I make you safe. If you wear a mask, you make me safer. And if we all wear masks, we're making everybody safer. The masks are not your first line of defense. Social distancing, physical distancing is your first line of defense. Homemade masks, which anybody can make, and I'm going to be posting a video later this afternoon. Homemade masks offer you a modicum of additional protection, but they are not N95 masks. So if you're wearing a homemade mask, it doesn't mean you can walk down the street and put your arms around your friends. It doesn't mean that you can now close the distance to less than 6 feet. None of those rules change. What the homemade mask does, or any mask does, is it eliminates or reduces your ability to spread the virus. I have to say reduces, it doesn't eliminate it, because you can actually sneeze through cloth, you can sneeze through a mask. The purpose of it is that mask, that face covering, will be the first thing that catches the germs that come out of your mouth, whether you sneeze or whether you cough. And the truth is that even when you breathe, we expel germs into the environment. And so the goal is to catch as many of those germs in your mask and keep those germs from landing on surfaces in front of you, below you, wherever, where other people unsuspectingly might touch the same surfaces. So I'm a believer that everybody should wear a mask once they're into a public space. I believe that everybody in a store should have a mask on, and I think the employees should have masks on. I've seen a lot of stores where they put up plexiglass partitions between customers and between employees. Anything to create a separation and produce a physical barrier to the spread of the virus, I think, is absolutely important, and I'm encouraging people to do this. I will add that if you wear a homemade mask or any mask, you have to be careful about how you take it off. If you think about it, if the mask is the surface of in front of your mouth is where the particles are being drawn to you, and if they land on the surface of the mask, when you take it off, you don't want to grab the mask by the front. You want to take the mask off from the back, holding on to either the bands or the strings, whatever it is, put it into a plastic bag or a paper bag, and do not touch the front of that mask. When you're ready, take that mask to a place where it can be washed. And I should say, wash your hands as soon as you take the mask off. But after you take it off and put it in the bag, wash them again, and then when you get the chance, take that mask and wash that mask. It is critically important. You just can't take it out and put it on again, and we do not want your hands on the front of the mask. That's important that you follow that kind of guidance. There's some other, good news in the county. We opened up our first state testing facility at White Oak yesterday. Dr. Gales will go more into that and how it's being used. But now it's our second facility. There's the MedStar facility in Bethesda, and there's this facility from the state, as well as your health practitioners may have access to tests. I'm a Kaiser patient myself. I know Kaiser has access to testing. All of this is based on referrals still, because there are not enough test kits. They're not available. It's not that we're not buying them. It's not that we're holding back on money. If we could buy them, we can and will buy them, but they are not available. They are hard to come by. And so the priority has been for people who are thought to be at risk and they need to test. So you need a doctor's referral to either use the MedStar facility or our facility. And there's a process which I'm sure Dr. Gales will go into. We will be opening up the Washington Adventist in Tacoma Park to give us some additional bed capacity. And again, that's a topic that Dr. Gales can expand on. And the last thing I want to say is I want to thank the governor's staff for working with us through all of this difficult times. Time and time again, we've been able to reach out to the governor and talk about our concerns. The council and I sent a letter to the governor the other day urging him to start keeping track of infection data, fatality data on a racial basis. And yesterday at his press conference, he announced that they were going to be doing that. So we feel that we've got a good working relationship with them. And he's certainly been one of the leading governors in this country. And I just want to acknowledge that. And with that, I will turn it over to Dr. Gales.
Good afternoon, everyone. Thank you for the opportunity, and thank you for your coverage. Your coverage to our residents has been vital and important, and making sure that they get accurate, up-to-date information to address their concerns and hopefully alleviate as much anxiety as they can during this time. I don't really have much to add on what the county executive stated, to give time for questions, other than to state that yes, the cases have increased, and we continue to look at those cases and continue to study them from an epidemiologic and surveillance perspective. And our EPI team is looking at how we can graphically represent the cases and be able to present them to the public. So hopefully within the next several days, we'll be able to release some of those graphic representations, and we'll continue to put out information based upon the data that we have access now in terms of age and gender distribution. The second thing I want to highlight is that, as Mark mentioned, we did have our first mobile testing site event yesterday at the White Oak vehicle emissions center. And our expectation is we will run that site every Tuesday and Thursday, at least for the foreseeable future. We will be open for business tomorrow, and the way that residents can access that is through a provider. The provider must utilize the CRISP surveillance system, which we usually use to track hospital data and share hospital data across the region. The provider goes into that. All providers have access to it. They can order the test for their patient, and then the patient receives a link to schedule their appointment. And then when they come in, it's all electronic. They provide a form of ID to confirm they are who they are, and then they go through the process, get their test. The tests are sent utilizing private laboratories. So the turnaround time, we're hoping to have an average of 48 to 72 hours to be able to turn those around to those who've come through the program. Other thing I want to highlight is we continue to also explore if there are other potential venues or opportunities to increase testing capacity. We don't want to just rest and rely on one center, because we recognize that even within that offering an alternative, that there still may be some barriers to accessing those services. And our goal is to try to leverage the resources we have to create low barrier entry points to accessing testing and accessing any of the other support services that we have. The third point I want to highlight is the idea of surge planning. As we shift from to when we're talking about surge, when we shift to that conversation, we have been talking and working with our hospital partners, the local level, our partners within the emergency preparedness group at the state and Maryland Department of Health around this notion of surge planning. Surge planning involves multiple steps, including identifying spaces within the current hospital, spaces to be able to offer care, changing beds from regular care to being able to use those for intensive care services if needed, and then also identifying other spaces that may be helpful to provide clinical care services, some which are our traditional clinical venues, such as former hospitals or clinical care sites, and others may look like utilizing non-traditional, non-clinical sites to stand up mobile hospitals and mobile clinical service sites. We continue to work on that diligently and hope to be able to make some significant announcements to give the community some sense of what we're doing, so it's not this abstract thing we're talking about, but they can see some tangible results to understand when we're talking about building capacity, and be comforted and rest assured that we do have these resources in place when we ultimately will need them. The last thing I want to comment on is the conversation that the county executive mentioned, the letter that was sent to the governor's office related to collecting data around race. This is important because obviously we want to make sure that we have as much information as we can at our disposal to be able to shape and guide the interventions that we're putting into place. What I will say though is that none of this, unfortunately, should come as a surprise to us. It doesn't come as a surprise. To those of us in the public health field, because when we talked about COVID-19 disproportionately impacting individuals with underlying medical conditions, we mentioned things such as diabetes, heart disease, asthma, respiratory disease. Well, historically, when we look at the data, it clearly shows, unfortunately, that those morbidities and diseases disproportionately impact communities of color, particularly Black Americans. And unfortunately, those longstanding historical disparities are playing out as we see in COVID-19 morbidity and mortality rates. So as we wait to get more data, we don't need to wait for the data to confirm what we suspected and confirm what we know. And we don't need to wait for the data to have deeper conversations about how we fix and really do fix those systemic structures that have been in place for decades in a meaningful way, so that if we, God forbid, we have another pandemic in the near future or later on, we're not talking about the same disparities and how they play out in terms of morbidity and mortality. That concludes my updates. I'd be happy to answer any questions that you all have.
As mentioned at the beginning, if you could just let me know which news station you're from and that you have a question, and we can unmute you one at a time. And if you're looking for your chat box, if you hover towards the bottom of the screen, there's a box that says chat.
I've got a request from Jess Arnold from WSA 9.
Yes, go ahead, Jesse.
Hey. Dr. Gales, question for you. So, the governor talked about yesterday these strike teams for nursing homes and how they'll be working with county health departments to help coordinate that. Can you speak a little bit to what you're doing, what the county has started doing to try to assist with those teams?
Sure. Well, in fact, we were excited to hear about that because we actually created our version of strike teams about 2 weeks ago. Because after we had the first few episodes of cases in nursing homes, we saw the increase from 3 sites to, I think we were at one point up to 10. We recognized that we needed to provide additional support and services, much like the governor mentioned yesterday. And so what we did is we are one of the unique jurisdictions in Maryland where the local health department actually oversees the nursing home evaluation process. So we have members who are part of the public health services team and licensing and regulatory services who work regularly with the nursing homes. And so what we decided to do was to have them work with our disease control staff. The disease control staff train them in terms of, how disease control and contact tracing, those processes work. And so we have been utilizing them to provide extra resources to the sites where we've seen cases pop up in terms of providing advice and guidance around infection control, doing an assessment of their stockpile of PPE and making sure they have those needs met, and also providing any other additional guidance to address their concerns and questions. So we've been doing that work. We certainly welcome any additional resources that the state can provide, and we think it's a good way to be able to provide an extra layer of support for some of our most vulnerable populations.
Hi, a question from Rebecca Tan at the Washington Post for County Executive Marc Elrich. I'm sorry if I missed this, but you mentioned masks. I'm wondering if you're supportive of the regulation announced today by the County Council to make mask wearing mandatory in grocery stores by customers as well as by employees. Do you support it? Do you think it's viable? Do you think it's plausible to get that number of masks within the deadline that they set?
I don't know whether it's plausible for the private sector to get that number of masks, or for each individual business to get that number of masks. I mean, obviously, even the hospitals are struggling to get masks. And I think one of the concerns I know that the health official has, and I'm going to ask Travis to talk about this a little bit, is that creating a sense that you have to go out and buy an N95 mask, which is what people may leap to because those are the truly protective masks, may exacerbate the existing problem that people have in terms of being able to get masks for first responders, frontline workers, and for people, for the hospitals and everybody who's involved in medical care. And these masks, because we have not had an active recycling program, which we're working on doing now, where we think we might be able to extend their life, they've been in short supply and they dwindle pretty rapidly. Personally, the reason I talked about it, and I've been talking about this now for a couple of weeks, is I believe everybody should wear a mask. I really do. I will say that, I don't believe if you're on a trail that it's necessary. But if I were on a trail and I stopped to talk to somebody, I think putting a mask over your face is the polite and proper thing to do to respect the people that you're talking to, to put it nicely. I think people ought to do this as a matter of course. But I've seen too much when you go into a store of people just get too close. They get too close to each other, and they certainly get too close to things like produce. And you can't, and how do you not get close to produce? And produce is usually below you. So in my mind, this is one of the worst scenarios for an infected person being out there, the potential to actually wind up expelling something on the produce without even coughing or sneezing, to me is a risk. I would rather minimize the risk. So, I've asked people to do this. I hope people will do this. I'm not opposed to legislation to do this. I've discussed this with our health officer. So I'll let Travis talk a little bit about it.
Well, I think to view this where we are today has to be viewed in the historical lens of how we things have evolved. This came up as a result of more data that showed that it is possible. It is less likely, but it is possible in comparison for a person who's symptomatic versus being asymptomatic. But we found data that it is possible to transmit COVID-19 even when you don't have symptoms. So the recommendation was that wearing a mask of some sort, if you are a person who has COVID-19, particularly if you're asymptomatic, that can provide an extra barrier from expelling virus and shedding virus into the world. That in addition to the other steps that we've mentioned, social distancing, washing hands, washing goods and services that we come into contact with. In the public health world, we make a large scale of recommendations. And our intention has been, and we've been working on since the CDC released that information on Friday, to make strong recommendations recommending and asking people to wear masks to provide that layer of protection. We know that any type of further action will need to be vetted very carefully through looking at all of the different ramifications and asking the necessary questions, because we know that anytime legislation is involved, it introduces a host of other questions that need to be vetted out carefully. In the meantime, that doesn't prevent us from making recommendations. And in fact, the county executive and I have talked about this and we did an interview together on Monday where the question was asked to us, do each of us wear masks? And I said, I haven't historically worn one, but based upon the CDC recommendations, I'll keep one in the car and I'll wear it when I'm out in public, particularly in spaces where social distancing is difficult. We recognize that there are going to be some challenges in terms of folks being able to secure masks and have things, even if they're homemade masks. So again, the perspective I take from the public health side is that we equip people with a toolkit of different options to be able to mitigate their risk, mitigate their chance of transmission, and mitigate their risk of coming into contact with someone else who may have symptoms or be asymptomatic.
Mm-hmm. And sorry, just a quick follow-up to for the county executive, Marc Elrich. There's some jurisdictions, particularly on the West Coast, who have made it mandatory not just for people to wear masks in sort of retail settings, but from the moment they leave their homes. Is this legislation that you're considering here? It would be sort of the first of its type in the region, I believe.
Well, the legislation is legislation coming from the council.
Mm-hmm.
And the way I read the legislation, it just applies to essential services. Mm-hmm. I'm not a doctor, but I'll just be blunt. If we know there's going to be another wave at some point, and if it were up to me, the day we know that we are approaching this or have entered it, I would ask everybody to wear a mask from that day on, because we're not going to know, just like we didn't know this time, who the carriers were. It's not like you walk around with a scarlet letter A or whatever, in the old, stories, people are not marked. You don't know who's carrying it. And if we knew that there was, the first cases reappeared, and we just told everybody, if you're working someplace, wear a mask, and if you're out where other people are, wear a mask, I think we would have knocked down the spread of this a lot earlier. I don't think we would have eliminated it, because the masks aren't perfect, either in protecting the wearer or protecting the external surfaces around the wearer, but I think we would have been better off. And until we get a vaccine, until we get treatments, we should do whatever we can do to make sure that we're better off. This thing is, I think it's clearly gotten to the place where we're sitting back and trying to manage this as best we can, doing everything we can to minimize the spread of it. And it's really difficult. I mean, it is hard to look at these numbers that continue to come in, knowing that, the people who are spreading it don't even know they're spreading it in most cases. That makes it hard to control. It's not like everybody's exhibiting symptoms. And, if somebody was exhibiting symptoms, I wouldn't expect them to be in a grocery store. If you were told you had COVID, you should not be going outside, even if you don't feel you've got a serious case. You should be home. So it's the people that I worry about are the people who may not know they have it, who are carrying it and inadvertently spreading it. And that's tough to determine.
I would just add one more thing, and I know there's other questions. Again, it's the idea, one solution won't be a holy grail. And we have to be mindful, again, of giving people with different options and equipping them with options. And so I think in addition to looking at strategies about masks, I think we also have to discuss how do we implement policies such as limiting the number of folks in a grocery store or in a retail setting to limit and mitigate transmission as much as possible. So again, from the health perspective, we look at all of these options and we try to make sure that we present folks with a robust set of recommendations to keep them safe and keep them healthy.
Scott Broom, WUSA 9.
Great. A lot of the mask talk that I was going to ask about in the chat has really already been covered by the county executive. I want to be sure I have it. You're not opposed to legislation, but you do have questions about the practicality of making them available to all. If you want to weigh in on that, please do. But let me use my question time to talk to Dr. Gales about local testing capabilities. We were able to talk about that yesterday at the testing location. Could you give us a fix on the status right now of the different types of tests we've heard about that are out there? We've heard about the quick turn test and the one that's taking 3 days, and any other testing that is coming into the availability of either local hospitals or you as a health official. We're just trying to get a fix for the public on what is available at this point and how much of it is available. Now that we've got a drive-through place open and the hospitals are more up and running.
Sure. So there are multiple layers of tests. There's two types. There's really two sets. There is the PCR test. That's an RNA test that looks at the virus. All of those tests basically take a snapshot of the virus to see if you have active infection. Then there is the other set of tests, which are referred to as serum-based or antibody tests. And what antibody tests measure is it actually looks at whether or not your body has had and mounted an immune response to having the virus. So it's a better indicator of if you've historically had the virus as opposed to you having an acute current infection. So those are the two different types. So for the viral, the RNA PCR-based test, that's what we've been talking about mostly in terms of when you come through the drive-through testing site, you get your test at a hospital, you get it through your private provider. That refers to that level of test. Now, many hospitals actually have purchased equipment or have repurposed their lab equipment to be able to run those tests on their platforms that they have in-house. Additionally, there are the private laboratories, including LabCorp and Quest. I think BioReference is another large-scale lab that is processing those tests from private laboratory space. Then we also have public health labs, such as the State Public Health Laboratory, that is able to run those tests too. Given the limited capacity of the public health labs, in many jurisdictions, those have been prioritized for the sickest of the sick. First-line responders who've been exposed, where a quick diagnosis is needed that could potentially alter the treatment course of an individual. So you can imagine someone who's significantly ill in the hospital, who's come into the emergency room or has symptoms that can't be explained by something else and in an ICU type setting. And those, in our nursing home situations where we have had residents become positive. And so the state health lab has been prioritized for those. Now, what the expansion is, you have seen a lot of companies say, hey, we have a new test that we're producing, whether it's rapid or within a 48 to 72 hour period. The challenge with those is, yes, those tests are available, but you must have the machinery that's specific to that company or specific to that particular assay and test to run. And so one of the challenges is we've even explored potentially purchasing some of that equipment. And so as those tests have come out, you can imagine the demand has increased. So one company in particular, we actually inquired about potentially purchasing a machine, and the wait list was 6 weeks to 2 months. And so in that setting, we have been trying to be creative in terms of leveraging our relationships with private labs that we use in other areas of public health services to be able to increase our ability to use those tests and utilize those resources to offer those resources to county residents. Now, the other test that you mentioned or that you asked about is our antibody-based test. These are significant because, one, it allows at some point, if we've got a lot of people who have been infected, it is a way to measure whether or not you have cleared the infection and you're free to go back to work because your body has mounted an immune response and you're cleared from it from that perspective. It also, one of the other potential strategies that is being looked at as a treatment modality is utilizing antibodies from individuals who have had the infection to be able to treat those antibodies and inject them into individuals who are having an active infection. The thought is that potentially if this can be further developed, that those antibodies would be helpful in helping those with a current active infection be able to mount an immune response faster and quicker and clear the virus as to prevent further damage. So those are the different test modalities, and when we're talking about rapid versus long-term, they're just more specific features within those two specific categories.
I just really appreciate the detailed background. I wonder, can you put a number on any of this that people can grab onto? Are there 100,000 tests available in Montgomery County, or the capacity to test 500 people a day? How can I describe this to people? How much testing is available in the county, and how much more you think you need to really get a handle on the epidemiology?
Well, that's a tough one to answer. The denominator is tough to put out because it's related to a lot of things. So each of the kits are made up of different components. So at some point there has been, so you've got nasal swabs and reagent, and I'm looking over in the corner of my office here as we have test kits there. At one point, there was a shortage in the nasal swabs, and then there was a shortage in the reagent. And when I mean reagent is when I do your nasal swab, I've got to put it into a container, into a solution, cap it, and then send it to the lab to be analyzed. And there's been a significant shortage of that over time. And so each of the labs have large capacities to be able to be sent to their regional centers for analysis. But the materials are the rate limiting step. So I can't really definitively say, we've got 100,000 test kits in Montgomery County right now because it's built upon systems that stretch across states. What I can tell you is that our goal in our mobile testing sites that we're setting up Tuesdays and Thursdays is to hopefully be able to do a minimum of 100 patients each clinic session.
Hi, this is Chris Gordon, NBC News 4, if you can hear me. A question for the county executive on behalf of our traffic reporter. There isn't much traffic on the street and a lot of families walking, bicyclists. Are you thinking, anticipating closing any streets and roadways in Montgomery County for purposes of keeping them safe?
Given the absolute lack of traffic anywhere, it's probably about as safe as they've ever been in Montgomery County. Nobody's asked me that question up till now. I'm happy to look at it. We still have there is some mobility issues because people are allowed to go out and still go to essential businesses, and all my essential businesses may not be conveniently located in a mall or a strip center. I don't think it's a bad idea, but then you're going to get down to enforcement. That are we going to have to put barriers in all these streets? And I guess we're trying to limit the context the police have to things that are really, really essential. Part of keeping them safe has been to make sure that they're only drawn into things when they really need to be drawn into things. So that might be a little difficult to execute, but I can talk with my folks about this and see what they think it makes sense.
All right, if I could just follow up then, both to the county executive and Dr. Gales. My colleague Scott Broom was asking for a number. I'm going to ask it a little different. It just seems with White Oak open, the average person is going to say 100 tests a day. This 3 weeks into this, with a surge and hotspot designation, it doesn't sound like you have enough kits. Simply put, do you have enough kits? Test kits.
Well, Chris, you are expressing the frustration that we've had from the very beginning related to testing capacity. We'd like to be able to test everybody. We'd love to be able to test thousands of folks. But the reality is we have been hamstrung by the lack of support given from the federal government in the testing arena. And that has been chronicled from the very beginning. And we're not the only jurisdiction that has been impacted by that. In fact, we actually created a blueprint to do mobile testing nearly 6 weeks ago. We've just simply not had the testing kits to be able to do it. I think in one of our previous Zoom meetings, and I don't have the manila envelope in front of me, we literally got a manila envelope full of 30 some odd test kits. They sent those to the state to be able to distribute to each of the jurisdictions. And so we were trying to hold on to that supply because we needed to do that when we had nursing homes to test residents there. And it has taken this amount of time to be able to leverage our partnerships with the private labs to be able to get enough tests to be able to offer it. We think we fixed that, but we share the frustration. We know that we offering 100 doesn't seem like a lot, but it's getting more people in who are symptomatic. And again, the principles of pandemic management rely on early testing. So early on in your symptom period to try to get you diagnosed, early quarantine, as the county executive mentioned before, we get you tested, we get you quarantined and away from other folks, because ultimately those are the most important steps that are going to mitigate transmitting to other folks.
So Chris, I want to add a little bit to that. I've been talking to both people at the state and local level on this problem of testing. So I know, for example, that the hospitals, for a while, had to send the tests out to be read. They were waiting 4 or 5 days to get results back about people they had in the hospitals. And one of the complicating factors then is if they knew who had COVID and who didn't, they could control when people needed to wear protective gear and when they didn't need to wear protective gear. But because they didn't know, they had to treat everybody in the hospital virtually as a potential COVID carrier. So they were burning through equipment at a really rapid pace because of their inability to get the test kits. Then when they got test kits, they ran into the problem of not having the reagents to use the test kits. So I talked to one of the hospitals and they were like, well, we got the kits, but we're waiting for the reagents. And sometime last week, toward the end of the week, they got a better supply of reagents. If you remember, this whole vehicle emission station proposal came out from the governor, I don't know, it must be 2-3 weeks ago. They were going to set up 5 stations and this was going to be great. And then everybody waited and wondered where the stations were. Well, the stations weren't coming because instead of getting what they thought they were getting from the federal government, they had 500 test kits. They had to decide between, do I make these test kits available to people at the stations on referral? Do I reserve them for places we already know are hotspots or where we've got issues? And so they decided not to open the 5 stations because they said the test kits would have been gone probably in a couple of hours, and they had no guarantee of a resupply. So we have an utter national failure here. And the news is coming out every day about when these people knew and what the projections were. And even Navarro, who's not a doctor but likes to pretend like he is on occasion, told the president, if you don't act quickly, you're going to have lots of death and major economic damage. The federal government should have mustered the availability of these kits on day one. And it is frustrating that people have to reinvent the kit. I mean, it wasn't like there were no rapid test kits out there, but the companies that had the kits didn't have the capacity to produce at the level everybody needed, and other people didn't get licenses to use those tests, to produce those tests and sell those tests. So you've got multiple parties trying to invent tests that they then can market so that, you know, they're able to sell them. It's I guess it's symbolic of a medical system that doesn't focus first on the care of the general population and sometimes has other things in mind when they decide how they're going to distribute their medical resources. But it's frustrating for everybody. We'd love to be testing. I'd love to be doing, you know, walk-in testing, getting to the point that people could come in the first time you felt something and get that, you know, get that off your mind, or get it off our minds, frankly. But we're nowhere near having that availability of tests yet.
Okay, Caitlin Peets, Bethesda Beat, do you want to try to ask your question? If not, I can read it out loud for you. Okay, I'll go ahead and read it. This is from Caitlin Peets, Bethesda Beat. She's hoping to hear from Dr. Gales and the county executive. We here at Bethesda Beat have heard repeated concerns from community members about commercial construction sites, particularly the Marriott headquarters site in Bethesda, who say workers are gathering in large groups, not complying with social distancing. With Governor Hogan's announcement yesterday that local health departments can halt essential businesses that don't comply, is there any rethinking at the local level about allowing commercial construction to continue or its merit as an essential business? And can you explain the process if you receive a complaint about a work site or business?
Okay. Well, let me be very clear. We mean business when we talk about the policies that we put into place to exact change and hopefully alleviate the curve, but flatten it, or however you want to talk about it. And so with the governor's directive yesterday, we have been discussing internally last night and today in terms of the best way to handle those concerns. At the moment, we've talked with our partners in the police department and have directed them, if they receive complaints, to direct those to us. We're going to identify a staff member to be able to vet those concerns and then be able to take the necessary steps moving forward. If we do find, consistent with the governor's language, if we do find that individuals are abusing those practices and not adhering to the practices that have been proposed and put into place, we will take the necessary actions required to curb that behavior. Certainly, we don't want to have to halt any businesses that have been deemed essential for a specific reason. But we certainly have to be mindful of that, and we'll take the necessary actions to make sure that they adhere to the governor's directives.
Just, you know, I made a specific call to the state regarding construction along the Purple Line because no sooner did he issue his order than, you know, people are still, and I could go out there today and I'll see the same thing. Workers are like shoulder to shoulder talking. And, you know, there are times when you can't respect 6 feet distance because of the work you're doing. You know, if you're lifting heavy things, there are times when proximity is necessary. But when they're not working or they're not actually engaged in doing something, they are still congregating. And they're classic examples of people who ought to have masks on because they're too close to each other. They're working too close to quarters. It is... If anybody ought to be wearing masks, I would say these folks ought to be right up there at the top of the list because they interact with each other constantly, probably more even than a grocery store worker does. They sometimes have to do things where their job requires them to be next to each other. They ought to be at least putting homemade masks on, if nothing else. But I support our folks in going out and taking the complaints and going out to the sites and telling people what the rules have to be.
And one quick follow-up from Bethesda Beat. Dr. Gales, can you explain the notion on the county health department's website that says demographic data isn't available for many of the county's COVID-19 deaths?
Sure. So this is consistent with what was discussed earlier on in the today's event. Is that we are hamstrung by the information that we receive from the state and from our lab results. We are working to correct that. Fortunately at this point, we don't have a ton of deaths. And so we're trying to track down that information. We're trying to track down the demographic information using our different databases and surveillance efforts. And making sure, again, that before we announce or put anything out, that families have been notified, because there have been a couple of instances where people have passed away, and it came back in terms of autopsy results that it was related to COVID. And so you can imagine during the time period, there may be a lag from when that has happened to when that gets reported. So we are committed to making sure the information gets released to the public in a timely, comprehensive manner. But we also have the responsibility to make sure that families are notified appropriately, and any individuals within the person's inner circle or circle of contacts are notified before we make that information public. But we're striving to get as much information as we can and be able to release that information. And we're hopeful that the governor's directive on yesterday will ultimately provide us with more information to tell that story.
Hi, Rebecca again from the Post. One last question from me. Any plans on closing down county parks or trails? We saw that the Shenandoah National Park just announced that it would close.
Are there any plans on shutting down park trails?
Yeah.
Look, I would prefer to keep the park trails open as long as people observe the distancing. If people are just running or walking and wandering off the path and not congregating, it's as good a place as any to be outside. And frankly, I'd rather be walking in the park than I'm walking on an abandoned street in downtown Silver Spring or Bethesda. The aesthetics are just much better. You know, the parks had to be told several times, frankly, to to put fences around the play equipment because people kept congregating. And, you know, we had to point out several times that despite our recommendations that this stuff be closed off, they weren't closing them off, and people continued to play on the equipment, sit on the equipment. I mean, the governor, noted that, people were having picnics on out on the play equipment and in the pavilions. And I guess people shared photos with them. And I saw the same kind of behavior. So eventually we got the equipment closed off. As long as people can maintain their distancing, then I'd like the parks to be able to stay off and open as a place to walk. And I expect park police and county police, when they see people gathering, to break them up. I had a really hard thing the other day. I was in Sligo Peak Park, which is by my house, and there were these kids playing on the play equipment. And I had to think of a tactful way to ask them not to play on the play equipment without saying something that was way too far over their head or way more scary than small children should have to deal with. And then their parents came over and I explained to them, and they were very happy. But, there were signs there, and the signs were not sufficiently dissuasive to keep people from doing that. So we just have to keep reminding people, enjoy the park, don't hang out with each other there.
Thank you.
Okay, thank you, everyone. That was all the questions we had for today. Thank you for joining us. And we'll see you next week for our weekly Wednesday briefing. Thank you.
Thank you all for tuning in and coming out and asking us questions.
Thank you.
We want to make sure that you get the chance to do this, and so we will keep this up.